Welcome to a deep dive into something, well, fundamental to all of us, our health. And not just, what happens when we get sick, but how we actually demand it, how we pursue it, maybe even invest in it. We're unpacking a really interesting research paper today. It's called Grossman's Generalized Health Demand Model, an application on Turkey. It looks at data from, wow, over 25,000 people. And our mission really is to understand health not just as something that happens to us, but maybe something we actively build.
Yeah, and what's really insightful here, I think, is how this study uses this pretty groundbreaking economic model, Grossman's model. And it shows health in two ways, really. One is as a consumer good, something we sort of buy or seek out when we're ill, but also, and this is maybe the more interesting part for our chat, as an investment in our own human capital. To sort of reframes health, doesn't it, as this dynamic thing we manage.
Okay, let's dig into that first idea then. Health as a consumer good. The study looked at why people actually go get medical care. I mean, Grossman's original idea was kind of like healthcare is an input, right? And health is the output. So what did they find about that immediate need, the demand for services right now?
They found a very direct link. Pretty intuitive, actually. People who are dealing with chronic diseases are just significantly more likely to receive medical care. Think about conditions like stroke or kidney disease, diabetes. If you have one of these, the need for care becomes really immediate, quite compelling. And the study put numbers on it. People with stroke, 1.87 times more likely to seek care. Diabetes, 1.36 times. So it really backs up Grossman's idea that we're trying to fix a worn-out health stock.
Right, like fixing a machine that's breaking down.
Exactly. Your health depreciates, you demand a repair.
That makes sense. It's like reactive maintenance. But what about delaying that repair? Does the study touch on why someone might, let their health stock keep declining?
Good.
Or even the flip side, preventative stuff? Does the model or this study explain why people don't always seek care before things get bad?
That's a great point. And it leads us straight into the other really important part of Grossman's model, health as an investment. While the consumer good part is about reacting when health goes down, the investment side looks at what helps us keep that health stock up, proactively. And this research, it really highlighted some key things linked to human capital.
Okay, this is where it gets really interesting for everyone listening. So beyond just reacting to sickness, what did they find actually helps build our overall health? The long game.
Well, they found a pretty powerful connection. Things like higher education levels, increased income, and also engaging in sports or exercise, even just regular weekly walking, apparently. All these things significantly improve someone's general health status. And what's really striking is how closely these track together. Like for every step up in income or education level, an individual's self-reported health got better by a similar amount, around 0.8 or 0.9 times better. It's almost 1-to-1.
Wow.
Yeah, suggesting these aren't just about money or knowledge in the abstract. They seem to be actual building blocks for your physical well-being. And conversely, as you'd probably guess, just getting older or having more chronic conditions, that naturally lowers your health status.
It really makes a strong case for, wider societal factors impacting individual health. So translating that, what does it mean for you, the listener? It sounds like it's about investing in yourself, right? Did the study mention things like health insurance or confirm the exercise bit?
It did, yeah. It highlighted that people covered by health insurance generally showed improved health status. So access matters. And yes, consistent exercise, even just walking regularly, showed a direct benefit to general health. It really seems to confirm that idea that putting effort into your health, whether through education, lifestyle, whatever, it builds your health capital for the future.
So this study, using data from Turkey, it gives pretty strong backing to Grossman's core ideas then.
Absolutely. It provides solid empirical support. And connecting it to the bigger picture, Grossman's model really did change how economists thought about health. Moving beyond just seeing it as fixing sickness and recognizing it as something productive, something people invest in for returns later on. It's still incredibly influential.
Yeah, you can see why it shifts the whole perspective. But like any model, it's probably not perfect, right? It's a framework.
Yeah.
Are there areas where people point out, maybe it doesn't capture everything?
Oh, for sure. No model explains everything. And critics, quite rightly, point out some nuances, like the original model didn't fully grapple with sudden, unexpected health shocks, think accidents, that sort of thing. Or the huge impact of lifestyle choices, like, say, smoking or heavy drinking. Those weren't really central at first. And health insurance actually was something added later on. Plus, it sometimes struggles with how, our social circles influence our health choices.
Okay, so there are refinements and ongoing discussions around it.
Exactly. But even with those points, this deep dive using the Turkey data, it confirms the model's basic validity is strong. And it offers really valuable pointers for health policy, I think.
How so?
Well, it really underscores how linked things like education, income, and public health are. It suggests that if you improve education levels or boost incomes, you might actually see improvements in population health as a result.
Right. It argues for looking beyond just doctors and hospitals towards broader societal investments.
Yeah.
So we've seen how health isn't just about avoiding sickness, but it's also this lifelong investment, a kind of personal capital we build. Thinking about everything we've just discussed, what really stands out to you?
I think it's that connection, that idea that investing in yourself through education, maybe income-generating skills, staying active, it's not separate from your health. It actually builds that health capital. So maybe the question for everyone listening is this. If that's true, what's one small, consistent investment you could start making today? Something that could give you the best long-term return for your own well-being?